Okay, now back to where we were. So the diaphragm, remember, that is the dome-shaped muscle that divides the thoracic cavity with your abdominal cavity. Inspiration is whenever you are breathing in. So your diseases of the respiratory system, one of the most common, of course, is asthma. It's a respiratory disorder. A causative agents from asthma is sensitivity to an allergen. Some allergens include dust, pollen, animals, foods. Stress can cause asthma to flare up, overexertion, and different types of infections. Your symptoms, whenever they start happening, bronchospasms will narrow the opening of the bronchioles. So whenever it's saying spasm, remember that's an involuntary contraction. So that'll take the little, you know how I referred to it as the upside down tree? So the little branches will start spasming. And where you're getting the oxygen circulating through your blood, that'll start constricting and narrowing. Your mucus production will increase, so everything starts getting really, really thick and hard to move. Your edema will develop in the lining of your cavities. So it's almost like you have, it's going to be really, really gross when I say this, but it's almost like you've got a loogie that's like stuck and you cannot get it out. You cannot breathe. Some more symptoms is dyspnea, which is difficulty breathing, wheezing, coughing with the expiration of sputum. So that sputum is that really, really, really thick, sludgy spit. And you have an extreme tightness in your chest. Treatment for asthma is bronchodilators are used. So that's your inhalers to enlarge the bronchioles. You can use an epinephrine, so an EpiPen, or you have to have oxygen therapy, so breathing treatment, O2 machines. Sometimes treatment can be easy as whenever your asthma is flaring up, if one thing that helps calm your body down is the cold. So whenever I have a flare up of asthma or I have bronchitis or things like that, and I start coughing so bad that I can't breathe, sometimes I can go and sit in the cold and I can breathe better. Or I open up the freezer and that cold air kind of shocks your system to make your body relax and breathe. So ways to prevent asthma attacks, you identify the allergen, so figure out what you're allergic to. You eliminate the allergen, or you can actually become desensitized to the allergen. Bronchitis is inflammation of the bronchi and the bronchial tubes. So if you look at this image, if you see in the lungs, which are your little black area on the screen, you see in the lungs, if you look at the white patchy areas inside of the lungs, that's the inflammation, that's the infection. Acute bronchitis is caused by an infection. Symptoms are productive cough, so cough where you're actually spitting stuff up. Dyspnea, so difficulty breathing, sometimes chest pain, and sometimes you run a fever. Treatment are antibiotics, expectorants to remove excessive mucus. So that's medications like your Mucinex to loosen all those mucous membranes to get everything to just let loose and to come out. One thing that's always important, and you really have to tell usually younger kids not to do this, but whenever you're coughing stuff up, if you're coughing and some stuff comes up, don't swallow it back down. Spit it out. Do not swallow it back down. That's just introducing the infection back into your body. Also with expectorants, so the Mucinex and things like that, one thing that you have to do whenever you're taking those medications is be sure that you read the directions, because most of those, an activator in it is water. So you have to drink a lot of water with this medicine for it to even work. Chronic bronchitis occurs after frequent attacks of acute bronchitis. It's long-term exposure to a pollutant or smoking. It's characterized by chronic inflammation, damaged cilia in your nose, and enlarged mucus glands. Symptoms are excessive mucus, a productive cough, wheezing and dyspnea, chest pain, and prolonged expiration of air. There is no cure for chronic bronchitis. You can take antibiotics when you develop an infection. You can use bronchodilators, so your inhalers, to open up your airways. And then most people have to have respiratory therapy, so they have to have breathing treatments. COPD is chronic obstructive pulmonary disease. It classifies any chronic lung disease that results in obstruction of an airway. COPD includes disorders such as asthma, chronic bronchitis, emphysema, and TB. And remember, TB is tuberculosis. Smoking is the primary cause of COPD. Other factors can include allergies, chronic respiratory infections. Emphysema is a non-infectious chronic respiratory condition that the walls of the alveoli will deteriorate and lose their elasticity. So carbon dioxide remains trapped in the alveoli and it results in a poor exchange in gases. Heavy smoking is the cause and prolonged exposure to air pollutants. Your symptoms are dyspnea, a feeling of suffocation. And whenever we say a feeling of suffocation, most of the time whenever you see commercials about medications for emphysema and COPD, usually it's depicted as an elephant sitting on someone's chest, or one of the most common ones, or one of the newest ones, has been a grandpa wanting to play with his grandchildren, and the grandchildren are depicted as like 3 little pigs, and he's the big bad wolf trying to huff and puff, and he cannot get a breath. Whenever people have the tightness in the chest and the feeling of suffocation, it literally is because their lungs can't expand enough to clear their airways. It is painful. Most people with emphysema do end up developing something called a barrel chest, and what that is if you looked at an x-ray of someone who has emphysema after they've had it for so many years, it will actually look like they have one of those big wooden barrels inside of their chest, like the lungs and the intercostal muscles will have stretched so much and lost their elasticity because the lungs have worked so hard that it actually makes the upper body expand more than it's supposed to. You will have a chronic cough, cyanosis, so you will have blue tinges around the fingers and around the nose and mouth. You will have rapid respirations with prolonged expirations, so you'll breathe in quickly, and then as you're breathing out, once you've got caught up, you're breathing out, and it's a long let out, like a long sigh. It does lead to respiratory failure, which leads to death. There is no cure for it. You can treat the symptoms, but one of the ways that you will lengthen the amount of good days that you have with it is to avoid smoking, use bronchodilators, make sure that you take care of any respiratory infections that you get. You will be on oxygen therapy, and you will do respiratory therapy. So you will work on expanding your lungs. You will work on positive breathing and keeping your oxygen levels up. An epistaxis is a nosebleed. That's capillaries in the nose become congested and bleed. We're about to run out of time again. Have to do another one. Causes are injury or a blow to the nose, hypertension, which is high blood pressure, chronic infections, anticoagulant drugs, so blood thinners, blood diseases like hemophilia and leukemia. Treatment, you compress the nostrils, you elevate the head, you tilt the head forward slightly, and apply cold compress. You can use nasal packs. If it's